This topic is too deep, but it's more like the psychological aspects of pain after after accidents and symptom relief. You, our clinic that I work out of mostly auto accident, slip and fall type stuff, and for the most part, the accidents that we see are pretty straightforward. They're not, yeah, all injuries in an accident can have a certain level of severity, but we're not dealing typically with like real severe accident related traumas like big broken bones, loss of function, yeah, things like that. It's mostly just your aches and pains, muscle sprain or muscle strain, ligament sprains, disc injuries, things like that. And and for the most part, people understand that they had a traumatic event. There's going to be symptoms involved with it, and as long as they follow through with recommendations, the likelihood of them having high levels of reduction of symptoms within the first couple months is very good. Unless the person during intake and interview in the beginning, we we see that they have some back history of traumatic experiences, chronic PTSD, emotional, physical abuse, something like that in their history. And when we encounter that, we, me and the other doctors that I work with, we kind of have an understanding going into the situation that this particular individual is going to may take a little longer to feel better, may not have good resolution of symptoms in the time frame that we would expect. Um, a lot of times in those situations, they have catastrophizing habits, and they have this inability to understand that the things that they're feeling after the accident are normal and that they're going to improve over time, even if in the beginning it may feel like they're kind of going up and down, disappearing, coming back, which is normal. But when you have people who are in these situations with some of the existing history of psychological, emotional, behavioral trauma issues, they can they can have a real difficult time regulating how they feel about waves and changes in symptoms as things progress. So, it just makes this very challenging situation anytime you are going to discuss with them how they're feeling, anytime you are going to discuss with them findings from imaging in particular. That becomes a very tricky situation because they're going to have a hard time, typically, again, generalizations, um, understanding that things like an injured disc or something like that will heal and improve over time, and that things like muscle straining around the spine heal, improve symptom reduction over time. They get caught in how they're feeling now. They get caught in the the thinking, the difficulty uh, making that getting into that headspace that things are going to get better over time. They get kind of stuck in this, oh man, this is bad, this is the worst, this is only going to get worse. And so it just becomes a real tricky situation when you're not only dealing with the traumatic event of the accident, depending on if it was a vehicle, if they were a pedestrian, if they were on a bike, or whatever it is, you pair that with their history of traumatic issues, and we run into this situation where our conservative management is going to be difficult to help them, and we're going to have to make sure that we are doing our best to uh, keep their expectations in check, always revisit kind of the physiology of healing, and do our best to coach them through that process, and hopefully we can come out the other side with improved symptoms, at least, maybe not full resolution, but at least in a better spot than we would have been before we started. Because we always kind of have a timeline on the people we work with. And the goal is always to make sure that they're, by the end of your timeline, they're at least improved from when they started, if not totally better. So it's a more challenging situation. It takes a lot more conversation, takes a lot more question answering, but as a clinician, you have to be prepared to work with folks who come in with underlying, behavioral, psychological, emotional, traumatic issues that are just being compounded by the accident and its severity. So do that with what you may. Check my channel for more. See you next time.